Hello, I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Myths. And today we're going to talk about two supplements that were shown in a clinical trial to help with arthritis pain from the knee and from chronic low back pain. Chronic pain is obviously something that as a chiropractor I address and treat day in, day out. And one of the things that's important to remember with chronic pain is that there is never any single approach that works. There's not a miracle adjustment, there's not a miracle soft tissue, there's not a miracle injection, there's not a miracle surgery that will fix chronic pain. Any recovery from chronic pain requires you to be an active player in your recovery. That means things like being more active, diet, weight management, yoga. Yoga is very bad for my business because people who do yoga they feel better and they're less likely to need me. But anything that can help lower inflammation from a diet or supplement standpoint has the potential to be a player. There's certainly been more than enough data on things like chondroitin and glucosamine, and the data is pretty solid on those. It's not strong, but it is solid. But one of the other things that we seem to forget is that healthy fats are actually help us control inflammation. So think your fish oils, your EPA and DHA, which brings us to this particular study. And it was a study done on people with, in Japan, in 120 people with chronic knee or low back pain. And they used two things. First of all, EPA, so eicosapentaenoic acid, a partial component of fish oil, and L-serine, which is an amino acid that plays a role in healthy nerve function and maintaining the myelin sheath, so the sheath that surrounds the nerve. And they found that the combination of these two that were given, they used them for 8 weeks, and then they followed them at 4 weeks, 8 weeks, and 12 weeks. And all of these time frames, these people did better with these simple supplements. Two things that were surprising about this study. First of all, was the EPA dosage in there was a mere 149 milligrams a day. Now that is about close to 10 times lower than what I would typically suggest, but they found that it was helpful in this study. And that's surprising that it was helpful, but also exciting that something this level. So what would happen if we increased our dosages? Would we have better outcomes? The other thing to consider is L-serine, as I mentioned, helps with healthy nerve function, specifically the sheath that surrounds our nerves. But one of the mainstream medical procedures for helping with low back pain or knee pain is something called radiofrequency ablation, or RFA, which is, most people refer to it as burning out the nerve. It's not, because burning a nerve would never be a good idea, but it is just destroying the sheath, the myelin sheath that wraps the insulation that surrounds your nerve, and they burn that out with electrofrequency, and those have a tendency to grow back because the body wants them there. So that's why a lot of times RFA is a temporary fix. But we have two opposite ends of the spectrum. In a medical standpoint, we have burning out the nerve sheath, the insulation. In the supplement standpoint, we have them supporting the growth of the nerve insulation with a positive benefit. So if it were me, I have no doubt which direction I would take, given the safety and the fact that these are just helping your body do what it's supposed to be doing. And radiofrequency ablation, RFA, also has concerns with long-term degeneration of the joint. So everything we're trying to protect, it probably makes worse in the long run. So as always, I'll post a link to this particular study in the comments section. Make sure you like this video, share it with somebody who you think needs information, and subscribe to the channel.